So this is session 1. This is the introduction session. So I want you to just start off thinking about why we need to understand pain. Have a few seconds just to think about why that might be important. So hopefully by understanding pain more, it will help us better understand the level of pain that we get, and hopefully therefore improve the management of how we deal with our pain. It might also start to change how you think about your problems and start being able to plan out your own sort of strategies as to how you might start trying to move forwards with things. So you can see the graph on the left. Often people's view of recovery is often quite a sort of nice straight line to the finish. However, in practice, it rarely ever follows this nice clear pattern, and actually is much more of a complex path than that, and often involves some progress and then sometimes a little bit of a setback and then a bit more progress. So really trying to encourage you all to stick with it. And keep persevering even when it's feeling like it's all sort of getting too much. It's really important to try and keep going, and hopefully long term you will start to see some progress towards where you want to get to. A really important thing to get in first of all is that we absolutely do not agree with this viewpoint. It's a very old-fashioned view of pain. And it's absolutely not in your head. Pain is always real, and it's really important that we get across that straight away. If it does at any point sound like that's what we're sort of how we're explaining things, then please do come back to us with questions and make sure that we kind of and maybe I'm able to explain it to you in a slightly different way, because they say it's absolutely not what we're trying to get across here. So think about how you would define pain. If someone was to ask you what pain is, think about how you would define it. Think about the words that you would use to describe it. The textbook definition of pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So a couple of important points within this sentence is obviously the fact that it is a sensory but also an emotional experience. If you think about the words that you would use to describe pain, sometimes those words can actually sort of describe your emotions as opposed to the actual sensation of pain. And again, also the fact that we can get pain when we have suffered damage, but also when we might be about to suffer damage, or if to do something. So if you think about if you bend your finger back, the fact that it will start to hurt before you actually start to damage any of the tissues as a warning signal. So if we think about what the point of having pain is there as an alarm system. It's there as to warn us of potential threats, and it's there to protect us from harm. So it motivates us to do something about the fact that we're under threat, whether we need to kind of move away from it or stop doing something, or to take some sort of action as a result of maybe some damage that might have occurred. So pain is there as a way of trying to protect us, to tell us about something, and to try and motivate some sort of response. So the key first message of this session then is that pain is there as a warning system. Again, take a few seconds to think about what would happen if we couldn't feel pain. Think about the effect that would have on our lives. Think about how we would have to live our life as a result of not having pain. So again, it would become very difficult. We wouldn't know that we had caused damage to ourselves. We wouldn't know that we needed to take an action to prevent this damage. So if we think about the example potentially of touching something hot, you wouldn't know that necessarily you were touching something hot, and you wouldn't know that you needed to pull your hand away, and thus might suffer a more severe burn than if you could feel pain. So pain is a very useful and is a normal response that we need in our body to help us understand and navigate our way through the world. Another question for you: does the pain level experienced reflect the amount of tissue that we've damaged? So think about the level of pain that you get with an injury, and think about how much pain you get and whether or not that reflects the amount of damage that you sustained. Have a think of some examples. So rarely does pain actually give us a good indication of the amount of tissue damage we've sustained. Often we think the more that something hurts, the worse the injury might be. But actually, if we look at some common examples, a paper cut, for instance, we know that actually the level of tissue damage is pretty tiny, but actually the fact that that really can hurt a lot. Again, different sporting injuries, we see some levels of fairly minor injuries that provoke a large response. We see some other major injuries that maybe provoke a very minor response from the patient, from the people participating. We know that some major trauma patients actually describe very minimal levels of pain. The fact that they can sometimes lose limbs or suffer large injuries to their limbs, and actually often report very little pain at the time of injury. And for those of you who've ever stepped on a piece of Lego, again, you will know that you can suffer a huge amount of pain, again, for very little tissue damage. So the level of pain doesn't always equate to the level of tissue damage sustained, and in fact, actually, rarely is this the case. So a quick recap of the session. The key messages to get from this session are that pain is there as a warning system, the fact that pain is both normal and useful in our system, the fact that pain rarely equates to the level of tissue damage sustained.